You know, our conferences really are for a wide range of students. We have students that are out of school a couple of years who've performed implant placement, basic surgery, dental surgery. But we also have a lot of specialists that attend our courses because they're just looking to sharpen their skills, learning from, two guys that have now been practicing for over 15 years.
General dentists, of course. We have periodontists, we have oral surgeons, we've had endodontists, we have had prosthodontists. It's a really wide range of people that come to it, and we do the Get Your GBR On course, which is obviously guided bone regeneration, socket grafting for the more simpler cases, and ridge augmentation for the more complex cases. The other course that we do is our soft tissue course, and the soft tissue course is very much related to implants, and everybody knows that once you grow the bone, you're often left with some soft tissue deficiency. And so what do you do with that? How do you treat that? And that's what we really focus on in the soft tissue course.
You're getting two clinicians that, while we practice very similarly, you get to see two different points of view in terms of the type of procedures that we perform. Both of us do a lot of guided bone regeneration and soft tissue grafting in our practices, but we both really evolved from different places.
Yeah, the GBR course, that was one where I got the last seat, I bought the last ticket, and it was maybe the most influential course I could have taken, just because it gave me the opportunity to offer patients a wide range of treatments, whether it's a CT scan that kind of scared me at first when I first graduated, or it was something that I could just tell in the mouth, like, maybe I should punt this to a specialist. But having that baseline of knowledge just gave me that confidence to be able to approach patients in a way that I would want to be approached with confidence.
People can expect to learn a variety of different techniques because we never think that there's one technique that you should learn and that should be the be-all and end-all. We always think that you should have multiple tricks in your bag.
Most courses, they tend to show you only their best cases. And so what we try to do is mix in predictable techniques and show you those before and afters and how we got to that point. But we're not afraid to show you our failures also and show you how to manage those complications, because that's something that's more important for somebody going back to their practice, to be able to really handle those complications and understand that it's okay. Things can go a little bit sideways sometimes. The important thing is how you manage those complications.
Man, I felt like I walked away with like maybe 10, 20 gems, and I've just been using them. And after I came to this course and I met people from last night who also took that course, everybody felt the same way. Just got like a bag full of gems, That's how it feels.